This is a 64-year-old man with symptoms of feeling a pop and questionable Achilles tendon tear. We will begin by looking at our sagittal images, as that's the primary plane. We frequently evaluate the Achilles tendon in. Starting medially, we can see the posterior tibial tendon here attaching to the navicular. Immediately medial to that is the flexor digitorum tendon, and then we can see the middle subtalar joint. Underneath that will be the flexor hallucis or hallucis tendon, and then we can see the middle subtalar joint, the posterior subtalar joint, the plantar fascia, and we can nicely see the full thickness tear in the Achilles tendon with the high signal intensity hemorrhage and fluid filling the gap. This is an approximately 1 to 1.5 centimeter tendon tear. You can see the retracted posterior upper portion and the retracted inferior portion. Notice that the remainder of the Achilles is thickened with intermediate signal representing chronic tendinopathy. As we move more laterally, we can see the posterior subtalar joint, we can see the fibula and the peroneal tendons laterally as well. The area of the sinus tarsi is filled with normal fat, with the intervening bifurcated ligaments and cervical ligaments as well. The anterior process of the calcaneus appears normal. On our axial images, starting from most superiorly, we can see the extensive subcutaneous edema, the tendinopathy in the Achilles tendon, which should be concave anteriorly, but is convex anteriorly. We can see the level of the full thickness tear filled with fluid, and again we will want to match this on all of our imaging planes to confirm the extent of the tear. We can also look for our ligaments and tendons. We can see the normal anterior-inferior tibiofibular ligament, the normal posterior tibiofibular ligament as well, and as we move more distally, we can see thinning and areas of focal thickening in the anterior talofibular ligament, representing chronic areas of previous injury. The calcaneofibular ligament appears unremarkable in this particular patient. On our coronal images, we can see a small focal area of cartilage abnormality in the medial talar dome, this high signal focus interrupting the normal area of the cartilage. We can look at the lateral tendons, and we can see the peroneus longus and brevis tendon. The retinaculum is also normal, holding these in their normal position. And we can note the peroneal tendons at their attachment, the base of the fifth for the peroneus brevis tendon. Medially, we have our posterior tibialis tendon, flexor digitorum, and flexor hallucis, and the intervening tarsal tunnel. So in this patient, we have a 1 to 2 centimeter full thickness tear of the mid portion of the Achilles tendon with a little bit of retraction as well and chronic tendinopathy. In addition, there is a medial talar dome hyaline cartilage defect in this patient.